Good afternoon, everyone. I'm Philip Osteen, Dean of the University of Utah College of Social Work. It is my pleasure to welcome you to this Social Work Beyond the Classroom presentation. As the name of the series suggests, these presentations allow us to delve into the work that engages our faculty members outside of their teaching duties and to provide additional learning opportunities for students, graduates, and others in the community. We welcome our virtual attendees. Thank you for making the time to join us here today live, or to those who are watching the recording at a later time. We express our sincere gratitude to those who donated while registering. These donations will support the Dr. Judy Watts Brady Scholarship, which benefits MSW students. The scholarship's namesake, Dr. Brady, was a trailblazing practitioner and adjunct faculty member here in the College of Social Work, who, among her other many accomplishments, was the first woman appointed as the director of the Utah State Division of Alcoholism and Drugs. To everyone who donated, we are grateful for your generosity, and again, thank you. Before we get to the presentation, on behalf of the College of Social Work, I want to begin by acknowledging that this land, which is named for the Ute tribe, is a traditional ancestral homeland of the Shoshone, Paiute, Goshute, and Ute tribes. The University of Utah recognizes and respects the endearing relationship that exists between many indigenous peoples and their traditional homelands. We respect the sovereign relationships between tribes, states, and the federal government, and we affirm the University of Utah's commitment to a partnership with Native nations and urban Indian communities through research, education, and community outreach activities. Today, we're excited to showcase Dr. Yitong Xin's work on the role of psychedelics in mental health and the treatment of substance use disorders. Dr. Xin is an associate professor here of social work at University of Utah. Working in the areas of substance use, trauma and minority stress, and resilience, her research is primarily centered around harm reduction strategies, such as psychedelic-assisted interventions and strengths-based methodologies. Dr. Xin's work aims to minimize potential negative consequences and promote strength and resilience towards overall well-being among individuals with substance use and psychiatric disorders. She earned her PhD from The Ohio State University and is a licensed social worker and an EMDR-trained therapist in the state of Ohio. Following her presentation, Dr. Xin will have about 10 minutes to respond to your questions. Please use the Q&A button at the bottom of your Zoom window to submit any questions that you might have. And with that, Dr. Xin, I turn it over to you.
Thank you. Thank you so much, Dean Austin. Hello, everyone. My name is Yitong Xin. I'm an assistant professor at the College of Social Work. So let's just get started. I'm going to share my screen. Okay, so great. So I think everyone can see my screen. Okay. So welcome to today's Beyond the Classroom webinar. I'm Dr. Yitong Xin, and I'm so excited to have all you here. Today, we are exploring a fascinating topic, psychedelic and resilience, an innovative approach to understanding mental health and substance use. So psychedelics like ayahuasca, they are actually powerful tools that go beyond typical treatment approaches, which means they have the potential to reframe clinical practice, especially for treating mental and substance use disorders. So today we will explore how to understand this experience from a resilience standpoint. We will look at the recent research findings and consider the broader implications for substance use and mental health. I hope this session will offer you some new perspective to think about resilience and how to use the power of plant medicine in treatment. So for today's Beyond the Classroom webinar, I will guide you through the following topics. First, I will talk about the therapeutic potential of psychedelic in treatments with some recently published research findings. Then I will introduce a new study focused on the connection between ayahuasca and resilience. We will also cover the study background, the acute and enduring effects of ayahuasca, the psychospiritual outcomes, and observed changes in substance use patterns reported by participants. Finally, we will discuss how resilience actually plays a role in this experience and the study's innovation and its implication. Okay, so before I briefly introduce psychedelic therapy and the history, actually, I'd like to invite you to join me in an interactive activity. So please feel free to scan the QR code on the screen. So you will be get to a website asking you a question, what comes to mind when you hear the word psychedelics? So please feel free to share the first word or maybe the first a few words that you think of when you hear the word psychedelics. I'm going to stop sharing so we can see everybody's responses. Okay, so I think is everyone able to see the screen? Okay, I don't think so. Hold on. Stop sharing. We try one more time. Okay, here we go. Great. So we have a lot of responses, actually. We can see people are saying out of body experience. Great. Yes, they are drugs. Exactly. And they are hallucinations. Exactly. Mushroom, right? If you think about psilocybin, they also call magic mushroom. Oh, and trip, right? A lot of people, they actually have a psychedelic trip. They travel to Peru, they travel to Costa Rica to have it. Great. New perspective, of course. Depression, for sure. Actually, a lot of psychedelics has shown their effectiveness in treating depression, right? Trauma, exactly. We see a lot of like effectiveness showing from psychedelic research about their how effective in reducing trauma symptom after psychedelic experience. Visions, right? Because they are psychoactive drugs, they will give you visions, which means you see something, right? Ex Yeah, innovative. Of course, that is the title for today's presentation. Insight, of course. So actually insight, which means a new understanding. A lot of people reported they have new understanding after using psychedelics, either about their relationship or about something happening in the past. But right now, they just have a new perspective to look at that. Euphoria, exactly. A lot of people reported they have euphoria experience, which is extremely happiness, right? PTSD. Yeah, we just talk about like how psychedelic can use for treating trauma and PTSD. Illegal, exactly. They are illegal in most of the Western countries, including United States, including Canada. So they're good. Yeah, the 70s. So 70s is actually a timeline cutoff. We will talk about that for sure. Okay, I love this. This is really good. So let's go back to my presentation. This is really good, okay? So let's look at okay, let's go back for the screen sharing. Oh, it's here, it's here. Okay, great. So yes, wonderful. I love the interaction. So I will just briefly talk about what is psychotherapy, especially we have some participants actually mentioned the 70s, right? That is a timeline cutoff. So psychedelic therapy, sometimes we also call that psychedelic assisted therapy. That means involve using psychedelics, for example, psilocybin, which they also have a name called magic mushroom. Some participants also actually tapped magic mushroom in this interaction activity, right? Ayahuasca. Ayahuasca, also sometimes we call that DMT, but ayahuasca doesn't equal to DMT. They have DMT in ayahuasca, okay? And LSD, which is also one type of psychedelics, and MDMA. People may hear MDMA with another name, which is Molly, which is more popular among young people. So psychedelic therapy involves using this substance to treat mental health conditions. The goal of using psychedelic as a therapy is to provide new therapeutic options for conditions they don't respond well to traditional therapies. For example, treatment-resistant depression, for example, post-traumatic stress disorder, which sometimes we refer that to PTSD, right? So psychedelics actually has been used for centuries in indigenous cultures. They use that for healing or maybe for spiritual practice. But psychedelic therapy is actually relatively new to the Western society. The interest in psychedelics actually grew in the 1950s to 1970s, with a lot of research came out showing promise for treating addiction, for treating depression, anxiety, and PTSD. Well, the early research actually declined in 1970s because of the policy restrictions, especially the Controlled Substance Act, which was passed in 1970s and published in 1971 to establish the United States drug policy. And a lot of the psychedelics, they are regulated under Schedule 1, which means there's no accepted medical use in the US. So since then, the interest in psychedelic actually has declined. But the interesting is in the early 2000s, there's something called psychedelic renaissance, which means with major institutions, for example, Johns Hopkins School of Medicine, they are actually leading new studies on psychedelic therapeutic potentials. So today, actually, there are more and more research teams and has published a lot of research studies to examine the effectiveness of psychedelic therapy. So this is just a brief introduction of what is psychedelic therapy and the history. So I just want to talk about some of our teamwork. Like I mentioned, a lot of research team has been studying the potential of psychedelics to treat mental disorders, and our research team is one of them. So in some of our published work, we explored how different type of psychedelics they can use for mental health treatment. For example, in one project, we compared changes in racial trauma symptoms. So when I say racial trauma symptom, they refers to the trauma symptom because of racial identity. For example, they experience the racial discrimination, and then they develop racial trauma symptoms. So we compare the changes in racial trauma symptoms 30 days before and 30 days after an experience with psychedelics. We examine 4 psychedelic drugs, which include psilocybin, LSD, and MDMA. Our results actually showed a significant reduction in traumatic stress symptoms following the psychedelic experience. Very interesting is a lot of the participants, they actually reported decreased depression, anxiety, and stress symptoms following the psychedelic experience. So this study I'm showing right now is just like one example of a lot of published studies, like kind of like showing the promise of psychedelic therapy in mental health treatment. Another project we actually studied is called ketamine-assisted psychotherapy. So we look at ketamine-assisted psychotherapy in an outpatient clinic for trauma-exposed patients. So all these patients, they have a history of trauma, and then after 6 sessions of ketamine therapy, we have seen a significant and a moderate improvement in PTSD, which is the trauma symptom. We also seen a great improvement in global functioning, great improvement in satisfaction with life, and then we also see a great reduction in depression. So this work on ketamine-assisted therapy actually suggested it can be effective in treating depression and PTSD among trauma-exposed individuals. So that is another example of our published work. In another project, we look at ibogaine and 5-MeO-DMT. There are another 2 types of psychedelics. So in that project, we actually collected data from a clinical treatment program in Mexico. So they have an ibogaine and 5-MeO-DMT program specifically for Special Operation Forces veterans. Those people, they reported a history of trauma exposure. So after the psychedelic experience, we observed a large improvement in self-reported PTSD symptoms. We also see a large improvement and reported reduced symptom for depression, anxiety, insomnia. People also reported increased satisfaction with life and cognitive functioning. So these findings from this published work actually suggested the combined ibogaine and 5-MeO-DMT, they may provide really substantial improvement for mental health. Especially we observed the therapeutic effects actually can up to 6 months, which means the improvement can stay up to 6 months, which is really exciting. So in the iBegin and 5-MeO DMT treatment program, we also specifically look at people who reported risky alcohol use behaviors pre-treatment. And after psychedelic experience, we actually observed a significant reduction in alcohol use from pre-treatment, which is before they use psychedelic, to 1 month follow-up, which is really exciting. We also see the reduction on the symptom actually stayed up to 6 months, which kind of showing a promise for long-lasting treatment effects. This is really exciting. In another study, we actually look at what are some predictors for people who use psychedelics to predict the outcomes. And in this study, we actually look at age and severity of depression and anxiety before experience as predictors for psychedelic treatment outcomes. And very interesting, we identified age, especially younger age, and the severity of depression, anxiety. They predict the satisfaction with life. They also predict the cognitive functioning and the trauma symptom after psychedelic experience at 1 month follow-up. So these are just some brief introduction, some of our published work, so which is resonant with the title. We call that therapeutic potential of psychedelics. But now let's turn our attention to ayahuasca. So you can see in the picture that is ayahuasca. Ayahuasca is a plant-based psychedelics. Actually, each psychedelic, they have unique properties, but ayahuasca is so special. We always say ayahuasca holds a special place because its cultural and therapeutic significance. Ayahuasca has been used for centuries by indigenous peoples for their religious rituals, or maybe for their therapeutic significance, for example, treating mental disorders in the history. And the traditional ayahuasca is actually made by brewing the two plants. One contains MAO inhibitor, the other one contains DMT. It's really similar like how we make tea. We just combine two plants together and brew it. That is how they make ayahuasca. Because ayahuasca, they have these two plants, right? One has DMT, one has MAO inhibitor. Actually makes it really unique because MAO inhibitors, they orally activate DMT. Makes the ayahuasca experience a longer lasting and very intense compared to other psychedelics, for example, magic mushroom. The combination of DMT and MAO inhibitor actually makes ayahuasca especially effective in helping people to explore their hidden emotions and achieve psychological breakthroughs. Like based on the research evidence, the orally activated DMT in ayahuasca, they actually can produce a significant subjective effects. For example, they have their perceptual modification, they have positive mood activation, they have increased risk of thinking, and that is happening in a relatively slow and progressive way, which means the effects of ayahuasca, they start about 45 minutes to 60 minutes after drinking ayahuasca, and they will reach the peak effect within 1 or 2 hours, and then they will start reducing the intensity after 4 to 6 hours. So we can say it's actually a little bit longer than many psychedelic experience. And recently, you probably hear the word ayahuasca tourism a lot. It refers to people who travel to Peru, to Costa Rica as a tourist in order to experience ayahuasca retreats. Why people will travel all the way from their home country to another country? A big issue is ayahuasca use is illegal in most Western countries. If you still remember the history when I just talked about the drug scheduling and ayahuasca, they all belong to Schedule 1, which means it's illegal to use in most Western countries. So for legal consideration, people will travel to Latin America to take it. And when I say tourism, which means there are a lot of people, it's already a popular industry with we don't have the accurate number, but people are saying at least we say at least thousands of people. I'm sure definitely more than that, people traveling to these countries in order to experience ayahuasca. And ayahuasca as one type of psychoactive drug, they can actually happen with a dynamic set of both positive and negative acute effects. So when I say acute effects in psychedelic context, that refers to the short-term responses and alteration, for example, happening to physically, happening psychologically, happening emotionally. So that is the short-term responses. So because ayahuasca, they actually can have a dynamic of effects, positive and negative. Actually, I saw some of the participants actually responded euphoria as one type of experience during the interactive activity. And I actually modified, I drew the elephant manually because I was thinking about the poem, The Blind Man and the Elephant, right? Which means each blind man, they actually perceive only one part of the whole experience. So if we think about ayahuasca experience, they are almost the same. We don't have two individuals, they experience exactly the same ayahuasca experience. Every person's experience, they are only one part of the big picture of the overall ayahuasca experience. Just like the figure shows, we say, some people say, I had a positive experience of connecting with the universe. So that is positive experience, right? Some people say, I experienced the feelings of euphoria, which is really positive. But we also have people reported saying, I had a negative experience of vomiting and diarrhea. I had frightening hallucinations. They are belonging to the negative experience. So for ayahuasca, actually, it's really common to have difficult and challenging physical and emotional experience. For example, people vomit, people diarrhea, just because of the drug effects. People also report the emotional challenging experience. For example, they saw something they are not prepared to see, maybe they heard something they're not prepared to hear. So that could all belong into the emotional experience. Interesting is even a lot of people, they have this challenging effects. A lot of them still report this difficult and challenging effects of ayahuasca actually contribute to their beneficial outcome. For example, they reported improved spiritual well-being, improved life satisfaction, and improved meaning in life, even they experience this challenging experience. So we have the word, some people will call that good trip because they really have positive experience. But some people who really have challenging experience, they will call that bad trip. But again, no matter good trip or bad trip, we still help people report beneficial outcome after that challenging experience. So that comes to my research question. In order to understand how people experience different acute effects of ayahuasca and the psychospiritual outcomes, I think about a resilience framework. So resilience frameworks, they actually specify protective factors and process of resilience, which has been supported by prior research evidence, saying resilience can buffer against the negative health outcomes, which is actually particularly relevant when we're thinking about how individuals navigate the psychological and emotional challenges of ayahuasca experience. So over the past 40 years, resilient theory, they have evolved into a collective resilient framework, which has been contributed by so many researchers from so many disciplines. I just showed you some examples for the notable contributors forming the resilience framework. For example, the Maston's resilience theory, the Rutter's resilience theory, the Werner's resilience theory. So for this specific study, I actually pick the master's resilience theory. The reason for that is because the way I define resilience and how I will think about that as a dynamic process, especially for my study design, I use a longitudinal study design, which means I collected data from different time points. So it's really like a dynamic system. So let's look at how I define resilience in this study and the study A. So resilience in this study was defined as someone's capacity to achieve positive adaptation, even they experience challenging effects of ayahuasca. And this they can still find positive meanings from it. And the goal of this study is to investigate the protective role of resilience and how it buffers challenges of the effects of ayahuasca experience and the associated outcomes. So actually, until today, no study have examined if resilience can influence acute ayahuasca effects. This is the first study in the field. So we're really excited to see how the results can contribute to the psychedelic research. Especially we see more and more people, they travel to Peru, they travel to Costa Rica to take ayahuasca, right? But we don't know too much by the public about acute and enduring effects of ayahuasca and what people should expect after taking ayahuasca. There is definitely a need for research study to focus on ayahuasca effects and the relative and the related outcome, and what can be some potential buffering factors in outcomes for the public education. So let's look at the following aims with my study. So I did a longitudinal perspective study, which means I collect data at different time points. So this is a quantitative study design. Study was collected through the Qualtrics survey. So there's 3 time points. We have time 1, which is before the experience. So we emailed the survey link to register and included participants. They will report their baseline data, which is pre-experience. So that is time 1. And for time 2, we collect data on the last day of their retreat. So that is where we get acute effect, which is a short-term responses, right? So that is time 2. And then time 3 is happening at 1 month follow-up. So after their ayahuasca retreat, people just get home and then, get back to their normal lives. And then we followed up at 1 month post their experience to see what are some enduring effects, which is the long-term lasting effects. So the aim, actually, in order to get more participants, we actually collaborated with some community ayahuasca retreat centers. So they send out all the research survey on my behalf, on the research team behalf, to all their participants, to all their registered participants. And any participant, they made the inclusion criteria and completed the screening, and based on survey, they'll be included and invited for the following surveys. And in order to appreciate participants' time and energy, and their knowledge, their experience, we paid participants, we provided incentives. So I provide $15 for time 1 survey, $20 for time 2 survey, and $25 for time 3. So this incentive was supported by multiple research grants in order to appreciate their contribution to science. So in today's webinar, we are going to talk about 2 aims. The first one is examine acute and enduring effects of ayahuasca on psychospiritual outcomes with a longitudinal study design. Specifically, we will look at acute effects of ayahuasca, which is a short-term responses, right? And enduring effects. So enduring effect refers to the long-term and persisting effects after people pass the acute effects of ayahuasca. And we will also look at psychospiritual outcomes. So what is psychospiritual outcome? That refers to psychospiritual well-being, okay, which means there's a connection between psychological well-being and spiritual dimensions. This outcome always reflect people's experience and the impact of their ayahuasca experience on both the psychological well-being and spiritual well-being. So it's really insightful for scientists to understand the experience. We will also look at the changes in substance use patterns among participants before and after their ayahuasca retreat in order to say, do they have the potential on reducing harmful substance use behaviors? And for aim 2, we will look at the role of resilience in this experience and the related outcomes. Okay, so what is my inclusion criteria for this study? So in order to be included and invited for this study, participants, they need to be at least 18 years old. They need to pass the retreat center's medical intake screening, which means they cannot use other type of drugs before the retreat. They have a specific period. You have to follow it in order to avoid the medicine interactions, because ayahuasca is one type of drug, right? They have to be able to read, write, and speak English friendly. The reason for that, because everything was designed in English. In order for the accuracy of responses, they have to be fluent in English. And we look at people who register for the 5 to 7 nights of retreats, and which means there are about 3 to 4 ayahuasca ceremonies happen in their experience. Okay, so let's look at the data collection. So after we get IRB approval, we actually also get the certificate of confidentiality from NIH in order to ask extra protection for participants' information. And then we collaborated with Sotera Healing Center, which is one retreat center in Peru. Right now, they have more locations. They also have a location in Costa Rica. So Sotera sent out all these recruitment emails on our behalf in August 2022. And then we reached out about 480 participants, which means they're about like the data collection happened about 1 year, a whole year. So we reached out 480 participants. They saw the consent form, they read about the study, and they have the screening link in order to determine if they are eligible for the study. And we have 374 participants, they click the screening survey, 291 then complete the screening survey and they met inclusion criteria. And we have 267, they complete the first survey, which is a pre-experience survey. We have 247 complete the time 2 survey, and there actually is a 92.5 retention rate. You can see we only lost 20 people, which is amazing. And then at the final survey, which is time 3, we have 233 participants completed. And in total, we have 233 participants completed all 3 time point surveys. And the overall retention rate is 87%. It's actually really good for a longitudinal study. So I will have to acknowledge my participants' contribution because I know my surveys are actually really long. And these participants, they're so eager to share their experience because they feel like this is something we need to share with the public because we don't know much. And maybe the experience, maybe it can share some therapeutic potential for some people for their treatment-resistant disorders. So they are really eager to share. So let's look at where are these participants coming from. So we can say they are from everywhere. We have about like, most of them actually from North America. We have 174 from the United States, 28 from Canada. We also have 3 people from Costa Rica, 6 people from Australia, 1 from New Zealand. We have about 4 people from Asia, about 17 people from Europe. So at the data collection period, UK still is still considered as a European country. So that is why we still included the United Kingdom under European area. Okay, so that is where the participants coming from. We can say they're from all over the world, which is give us a great diversity of the participants. So let's look at the demographic informations. So the average age about this 233 participants who completed all 3 time point surveys, the average age is about 41. It's about middle age. The standard deviation is about 11 years. We can say the majority is female in biological sex, and we can say most of them identify as white or maybe Caucasian. And then we also have 92% people identified as non-Hispanic people. one thing is really amazing about this participant is the education level. We have over 95% of the participants reported they have at least attended or maybe they completed college degrees. Even more amazing, we have almost 41% participants, they reported graduate school and professional school attendance, or maybe they completed degree, for example, including PhDs. And for the employment, we have 54.5% people reported full-time employment, and we have 71% of participants reported the annual household income, which is over $75,000. And we also have people reported, most of them reported they either never married or maybe they married or living with a spouse. And the one thing I also ask if do they have any religion belief before their experience? We can say most of them, they reported no religions, which is really interesting. Okay, so what's people's intention for attending ayahuasca retreats? We can say almost 84% of the participants, they have the intention for treatment. They probably read that somewhere, maybe they read some scientific article, or maybe they heard that from their clinicians, or maybe they heard that from friends saying there's a potential for treatment. That is why they registered ayahuasca retreats. We also have about 85% people, they attended ayahuasca retreat in order for spiritual experience. Like I mentioned, ayahuasca is pretty unique because of spiritual experience. So a lot of people, they are looking for spiritual experience. Of course, we also have 24% people, they register because they just want to have the recreation, for recreation. They just want to explore it either out of curiosity, maybe they just want to have a fun time, which is totally okay. So that is the intention. So I also ask about if people have past psychedelic history before their ayahuasca retreat. We can say most of people, about 80% of the sample actually reported past psychedelic use experience. And people actually reported they have used a magic mushroom, they have used LSD, MDMA, things like this. And among these 80% people who reported past psychedelic use, we actually see about 20%, they specifically mentioned past ayahuasca use experience, which means this is not their first time using an ayahuasca and register with ayahuasca retreats. So that is the demographic information. So let's look at the acute effects. Remember, acute effect refers to the short-term responses. And I know this term looks like the data looks really complex. So we can look at this in figures. So what is mystical experience? So mystical experience, which refers to people may experiencing some mystical after taking ayahuasca. For example, people may say, I lost my usual sense of time or maybe place or things like that. That is a mystical experience. We also ask about challenging experience, which specific focusing on the difficult and intense experience people experience during the ayahuasca sessions. For example, I feel really sad during the session, or maybe I have fear, or maybe I feel hopeless, or maybe I feel alone. That could all belong to the acute challenging experience. Also, we look at the purging experience. So the purging skill was actually designed by me. So this is a new skill. Because a lot of people do reported purging experience, it could include physical purging, for example, vomiting, right? They could also include emotional purging, which we call the emotional release, for example, crying, for example, laughing. They could all belong to the purging experience. And psychological insight, they actually refers to new understanding. And I remember during the interactive activity, some of you actually mentioned insight, understanding, right? That's exactly what we are talking about here, psychological insight, which refers to a new understanding, new realization people had during their ayahuasca experience. Typically, that refers to their emotion, their beliefs, their memories, or maybe their relationships. We also specifically look at the emotional breakthrough, which refers to participants, they had that moment, which is strong emotional release. That could be really, really, we call that a moment. That is why I call it a breakthrough. So these scales all ranges from 0, which means no this experience at all, to 5, extremely, which means I had extremely this type of experience. And look at the figure, we can say people all reported about 2.5, which is a middle, the kind of the mid of the scale, especially for mystical psychological insight. They are really high. They are above 3. For emotional breakthrough, they are 0 to 10. And people, the average score is 7.75. It's also really high, which means people reported strong mystical psychological insight and emotional breakthrough. Some people reported some challenging and purging experience. Like I mentioned before, not everyone experienced this challenging and purging, but most people, they do. So that is acute effects. And let's look at enduring effects. So when I say enduring effect, remember I mentioned that is the long-term effects. So when we are asking people at 1 month follow-up, like, oh, how the experience actually changed to the long-term and persisting changes in your life, specifically, we ask about life satisfaction, their life's purpose, life's meaning, social relationship, and their attitude about life, self-death, their behavior, how spiritual they are. The skills is actually from -3, which means I had a strong negative change because of ayahuasca, to 3, positive 3, which refers I had a strong positive change after taking ayahuasca. And let's look at the mean score. We can say they are all positive. They are all close to 2, which means they all have really positive and long-term persisting changes after taking ayahuasca. So this is the enduring changes. So when we are looking about the psychospiritual outcomes, we specifically look at how resilience change from baseline, which is pre-experience at time 2 and time 3. We also look at their satisfaction with life, the presence of meaning, which means they have meaning present in their life already. And are they searching for meaning? And we also look at their spiritual quality of life. So let's look at the figure together since the data is more complex. So we can say the resilience actually increased significantly from baseline to time 2, right? Look at the left with the color change. It's increased from 114 to 126. And statistical analysis actually there's a significant increase. And at 1 month follow-up, it decreased a little bit, but not much. It still stayed positive, which is still stayed significant improvement. Similar for satisfaction with life, we also say it's increased significantly from baseline to time 2, reduced a little bit, but not much, still stayed positive at time 3. Similar thing for spiritual quality of life, these two. So for spiritual quality of life, they have 2 subgroup. So one is called self-efficacy, which is really about how confident people feels about like handling challenges in life. And we also have life scheme, which refers to if someone feels about they can explore the meaning of their life. For example, people may say, I don't have any purpose in my life. People may say, I feel I have purpose in my life. So that is spiritual quality of life. We also look at the presence of meaning and search for meaning. So presence of meaning, we can say people realize they now have a clear sense of purpose after the experience. We can say from baseline to time 2 is actually increased significantly and then stayed therapeutic potential at time 3, right? And for search for meaning, this actually decline because they are searching for meaning. If they're searching for meaning, that means they don't have meaning in their life, right? So that is actually refers to they found their meaning after the experience because declining. At the baseline, a lot of people reported, I'm searching for meaning, but this search for meaning activity, motivation, they actually decrease at time 2 and time 3, which means people found their meaning after ayahuasca experience. So that is for psychospiritual outcomes. So we see how the changes from baseline to time 3 actually also validate the potential of psychedelic, especially ayahuasca in psychospiritual treatment, right? Okay, so let's look at the changes of substance use patterns because I'm really interested how people can change their substance use behaviors after ayahuasca use. So among people who reported substance use during the past months after their ayahuasca retreat, we have about 156 people reported they used the substance after their ayahuasca retreat, after they returned to their home country, they used the substance. Okay, so we can see there a great decrease in craving for this substance. We also have a significant decrease for use frequency. And the top three substance people reported they experience the largest decreased craving and use frequency are alcohol, cannabis, and hallucinogens, which is actually suggests ayahuasca may lead to decreased cravings and use frequency for substance, which is actually consistent with some existing psychedelic research, not specifically on ayahuasca, but on other types of psychedelics. So this is really saying about the potential to treat drug addiction issues with ayahuasca. So let's look at how resilience actually influence the experience. So I specifically look at how resilience can influence acute challenging experience, right? Because we are wondering why people had this challenging experience, but they also report positive psychospiritual outcome. And I hypothesize because of resilience. And the analysis, a hierarchical regression analysis actually showing resilience is a predictor. But the interesting is we see resilience is not the same direction. It is a predictor, but it's opposite. We observed higher levels of resilience pre-experience. They actually predicted more intense acute challenging experience, which is different because initially, based on existing research evidence, they are all saying resiliency can predict less challenging experience, but it's not the same for this study. But we will say it's not unfortunate at all. Actually, this is exciting because this is the first study looking at resilience in psychedelic research. And all pre-existing, they're not on substance use, they're not on psychedelic use at all. So this is actually new approach, new insight to contribute to the field. So there are several potential explanations why higher levels of resilience actually predict more challenging experience. So we thought about like maybe because people with higher levels of resilience, they see these challenging and stressful situations, they're not that challenging for them and they feel more confident about handling. So that could lead to more open to experiencing this challenging experience. And people may be better at recognizing all these physical challenging symptoms, emotional challenging symptoms, which actually lead to more report in their survey, right? Also, people with higher level of resilience, maybe they just feel like I'm more confident to cope with this stress with my existing coping strategy. And then they are really confident about their ability to handle it. That is also could be the reason why people reported more challenging experience in the surveys. So there are just some potential explanation. The exact mechanism for why higher levels of resilience actually predicting more, we don't know, right? But there definitely will be more research looking at that, why higher level of resilience is actually predicting more. But this is just like the beginning of a lot of research study, and this is just really exciting. Like I mentioned, this is just really the first study using resilience framework to look at psychedelic experience. Okay, so we also try to understand if someone's baseline resilience, they can actually moderate. So for people who don't understand what moderate means, it's actually, you can consider that like if resilience can change the connection between this challenging experience and psychospiritual outcome. So we divided people into three groups based on their baseline resilience level. So we have low, we have medium, we have high with different colors. So we look at their connections with the search for meaning and then their challenging ayahuasca experience. So if we look at the low resilience, which is actually the right one, the red line, we can say there wasn't much change in their search for meaning, even they experienced this challenging experience, right? It's almost flat. If we look at the medium resin, which is the orange color, we can see people, they show the slight increase in search for meaning as they experience more challenging, but still not that significant because it's still pretty flat. But if we look at the high resilience, which is a green line, we can say for people with high resilience, the relationship between challenging experience and search for meaning in life is much stronger. We can see the slope here, which suggested that people with high resilience, they may be more open to reflecting and finding deeper meaning when they experience these challenges. So all in all, this figure actually saying that resilience actually can moderate, even strengthen the relationship between the challenging experience and search for meaning. The takeaway from this figure is resilience can influence how people process and make sense of their challenging experience because that can lead to more search for meaning. So I'm just going to wrap up quickly on the study strengths and limitation. This is the first study focusing on resilience in the field. So it definitely makes some contribution. We use a longitudinal study design, which gives us the data. We can look at the data with a deeper understanding because we can see the changes over time, right? We also have international participants. We have really strong sample size with a strong retention rate. We have 87%. And we used a primary data collection, which gives us a lot of information focusing specifically on resilience. This study actually also offers the unique connection between ayahuasca, which is one traditional plant medicine, and also the need for treatment of mental health condition in Western society. I believe this study offers some bridges to we kind of like to bridge the gap between the indigenous healing practice and the modern healthcare in the Western countries. This definitely we build a strong, enduring community partnership with the expectation to see more collaboration and study published in the future. There are also some study limitations. This study relied on self-reported measures, so maybe we have some recall bias. This is an observational study. We don't have control groups because everything was happening remote. But in the future, when we have all these requirement resources, we maybe do some clinical trial and maybe do some control groups comparison so we can have a better understanding of the effects. We also provide incentives. Some people, they may influenced by that to report some desirable outcomes. And the purging experience was developed by me. Even they showed great understanding of like people's purging experience, but just know this is the first study we use this skill. So it definitely, we need to go through more validation with more research funding to support it. Even we have international participants, but most of them, they are white, they're from North America. So we cannot claim all the research fundings can be applied to everyone, right? So that's the study limitation. And I just want to quickly talk about the innovation and implication. So we already talked about the potential benefits of psychedelic-assisted therapy, how that can influence clinical practice. So for social workers or maybe other healthcare disciplines like nursing, public health, doctors, they can all think about how we should be knowledgeable about these interventions, especially think about their legal and ethical considerations and how to integrate that to treatment, especially people who failed the traditional treatment. How could we offer the alternative option for treatment? So we definitely need more education and training. We definitely need diverse perspective from different disciplines to push forward this innovative approach in treatment. So I will end up my presentation quickly, but I just want to acknowledge the funding support. This study was supported by multiple research funding and also by private donor research grant. And I really appreciate, I have that deep appreciation to my participant and the ayahuasca community member for their contribution, for their sharing information for this study to push forward the science, the scientific understanding on this specific area. I also appreciate my community partner, Soterra Healing Center. They actually help us to connect with the participants. So again, I will end my presentation now, and I will leave you with a quote I feel really resonates with me. The journey with plant medicine is not always easy, but it's a testament to the resilience of the human spirit and to the transformative power of nature's gift. And that is my presentation. Thank you so much for your attention. Thank you for joining me this afternoon. If you have any questions, please feel free to email me at yitong.xin@utah.edu. And these are my animals picture. Okay, I will open up for questions. Okay, let's look at some questions. Are there studies studying the long-term effects of use of psychedelics, or is it still really early stage in research on this topic? Is the proposed treatment model a one-time use of psychedelic or multiple treatment over time to treat mental health? Well, this is a really good question. So first, there are a lot of studies going on. Like I mentioned, there are more research teams right now studying psychedelics. So we definitely have studies. They actually following participants longer. For example, they did follow-up at 1 month, they did follow-up at 3 months, 6 months, 12 months. So we are examining these long-term effects. But just know this takes time. Data collection, data analysis, data cleaning all takes time. And when you finally see the published article, it probably already 2 years. But yet there's some published work. So I will encourage you to check some work from Johns Hopkins because they have a big team. They have a big center for psychedelic research. You can also check some of my published work. We actually look at the long-term effects. And for the treatment model, it depends. For some research studies, we look at one psychedelic experience, which means we ask people, hey, can you recall the most powerful, most transformative psychedelic experience you had, and then talk about the effects of that. So that for some studies, we do that, right? But for this study, for example, the ayahuasca study I just talked about, actually that is a combination of multiple ceremonies, which means that they have multiple ayahuasca experience. So it really depends, okay? I hope I answered your question. And the next question, when do you predict it will be legal for medical use? Well, it depends. I will say we're still very early, right? We need to be responsible for healthcare for the patient. So we really need to take time. We really need to take time. I keep saying that to all my team members, also my collaborator, everyone agree with that. We need to take time because this is one type of drug. We really need more research evidence to support that it's safe, right? It's safe for patient to use. So I cannot give the exact timeline. I cannot predict it, but just know we have seen some progress for some psychedelic, for example, ketamine, MDMA. We have seen they went through these clinical trials. Especially for ketamine, we can say it's already legal to be used in medical practice in some states. Actually, in the state of Utah, there are multiple clinics, they offer ketamine-assisted therapy, which is actually really amazing. Okay. Okay, you mentioned lack of diversity in your study sample, and it seems that most participants likely have a Western cultural lens. Do you have plans to conduct future study that might focus on the experience effects of ayahuasca with indigenous people or groups? Yes, exactly. I agree. So that will be the next step of my study. So we are actually going to do some expansion, which is a follow-up study. I will definitely do, especially focusing on indigenous community. So I'm actually designing a new study. We are going to talk with the indigenous community, especially from the Amazon, what their perspective about the popularity of ayahuasca tourism, right? Ayahuasca, this plant medicine, they belong to their community. But right now, all these Western people, they came in, they just try to use the drugs. What's their perspective and how do they feel about the popularity of tourism? What's their suggestions for future integration? So right now we are seeing the potential of using that for medical treatment, but we need to be mindful, be cautious, be respectful for the indigenous culture. This is their medicine. So there is definitely something for future practice. I thought there are more questions, but I really couldn't answer that because the time is up. But feel free to email me. I shared my email address. I'll be happy to get back to you to get your answers answered. Okay. All right. Thank you so much.
Yeah, Dr. Yin, thank you so much for presenting today. I'm sure, as the questions that were coming on, we could go on for hours, but, certainly being, respectful and mindful of your time and that of our colleagues, alumni and students. Only want to be respectful of everyone's time. Once again, we appreciate learning about your meaningful work on this issue, and we look forward to your future research. By all accounts, it looks like a number of people will be reaching out to you in the future, so thank you very much. For those of you that joined today and are seeking continuing education hours, please watch your email in the coming days for links to the recorded presentation and a brief quiz. Upon successful completion of a quiz, a confirmation of CEU hours will be emailed to you. As Dr. Osteen, Dean Osteen, has communicated, the College of Social Work is committed to taking the evidence generated through our research and from our labs, not only to future social workers sitting in our classrooms, but also out into the community and to practitioners beyond our state lines. We hope you will join us again for our next event, which will be held 1 week from today on Tuesday, November 19th. This webinar is part of our Grand Challenges for Social Work, featuring Ann Asman, a gerontologist with the Huntsman Mental Health Institute, and will focus on how we can all challenge assumptions around aging. You can find details about all of our events on the college's events webpage, which is now being linked to in the chat. Again, just thank you everyone for being here today, and we look forward to seeing you at future events. Take care, everyone.
Thank you. Thank you.
Bye-bye.
Bye.